We haven't mentioned much about specific bursitis conditions, but with acute bursitis, if they have pain and it's very tender right around that lateral portion of the shoulder where the bursa is in between the joint, then we don't want to move the shoulder in any uncomfortable positions where it reproduces that pain. So if there's any indication of that, you just work around the joint, not right into the bursa, and then their home care would be icing at least 3 times a day, 30 minutes on, 30 minutes off. And if it's inflamed, of course, anti-inflammatories of some sort would be indicated. If they haven't seen a doctor yet, they probably should. If it gets to be a chronic condition, it will take longer to eliminate if you don't take care of the inflammation right away. The home care for our bursitis is just to have them hold a weight in their hand. If they don't have a weight, usually a light weight, just do a can of food, something that is going to help traction the joint, and then have them start to just let that arm dangle and do circles for about a minute clockwise, a minute counterclockwise. And what that should help do is traction the shoulder joint, take the pressure off of the bursa, and then with ice and anti-inflammatories, it will help decrease the swelling. And then once the swelling is down and you're able to get more movement, then you can help balance out the shoulder so there's not as much frictioning in that joint that causes irritation in the bursa. Now, we did a specific part of our treatment was for frozen shoulder. So to keep the adhesions unlocked from our joint capsule work, if you ask your client just to do what they call wall walks, and just come up to the wall for me, Hank, and just as far as you can go comfortably, you want to go walk up the wall as far as you can, and when you get to a comfortable spot, just kind of lean in and just stretch into that joint. Very good. And relax. And then another home care that we give regularly is to do against a door jamb or window jamb. Just back up towards me and put your arm against there. Wherever their pain-free end range of motion is, you want them to push into the wall. That fires off the pec major. In this case, it's the upper fibers. Fire and relax, and then he just steps forward to stretch. Don't lean forward, just step forward to increase that stretch. That's a good one to get in the habit of doing on a regular basis. It's very simple, and you can do it just about anywhere, and it'll help keep those shoulder joints in alignment and keep those pecs from pulling on the shoulder joint.